Welcome everyone to today's conversation around CSH's report on advancing supportive housing solutions to reduce homelessness for people impacted by the criminal legal system. We're going to have Bianca Carter from Trinity Church Wall Street be able to kick us off.
Thank you, Cassandra. Good morning, everyone. I am pleased to welcome you to this important conversation today. My name is Bianca Carter, she, her. I am the Program Officer for Housing and Homelessness at Trinity Church Wall Street. Trinity Church Wall Street is first and foremost an Episcopal church that has been with New York City since our founding in 1696. I'm a member of the church's philanthropies team, and our grant making came out of an internal discernment guided by our core values and engaging all of our stakeholders. Last year, our New York City grant making totaled $30 million across 158 grants, including all the organizations that you will be hearing from shortly. We have two New York City grant making initiatives, and both have a goal of dismantling racism by ending mass homelessness and mass incarceration. We know that these cycles are interconnected, and thus a pillar of the homeless and housing and homelessness strategy that I work on centers New Yorkers who are directly impacted by the criminal justice system. The goals of this strategy, which we call internally Liberate, is to first end continuous punishment for poor people with criminal records. Second, to increase and develop housing options explicitly for this population. And third, to support their holistic needs and center their voices in the movement to end mass incarceration. Advocating for the creation, expansion, and strengthening of supportive housing options is key to achieving these goals. And thus we are really excited to be able to be in partnership with the CSH Metro team. And we want to congratulate them for producing and releasing the support that we will be discussing today. So thank you again for including Trinity. We're proud to be in relationship with all of you, and I'll pass it back to Cassandra.
Wonderful. Thank you, Bianca. So welcome, everyone. My name is Cassandra Warney. I'm a senior program manager with CSH, where I co-lead our New York Justice Reform portfolio. Prior to joining CSH, I traveled across the country for 6 years with the Council of State Governments Justice Center, bringing together stakeholders across the political aisle to pass legislation to increase community resources for people who are formerly incarcerated. And my last projects, my focus was on bringing supportive housing into those criminal legal reform efforts. So as someone who lives in Brooklyn, I am incredibly grateful today to be talking about how New York City is going to be expanding supportive housing for people at Rikers who need it. I'm going to give you some highlights of the report that we recently released that's going to be shared in the chat. And then we're going to reserve the majority of the time for our panel discussion, followed by a Q&A with you, our audience. So CSH is a national nonprofit focused on increasing supportive housing in our communities, as well as the quality of services being delivered. For the lines of business that we do, we focus on policy reform, which is today's conversation. We also do a lot of training and education around best practices, provide consulting, and we also lend. We're a community development financial institution who funds the early stages of affordable housing development that includes supportive housing set-asides. I also want to mention my colleague Lauren Velez, our team's Associate Director of New York. She'll be monitoring the chat and chiming in, including during the Q&A portion. Before I give you the highlights of the report, I want to be able to introduce the panel that we have today that we're really excited about. We have Commissioner Molina, who assumed the role of Commissioner of New York City's Department of Corrections on January 1st. He brings experience modernizing correctional systems through robust programming, building staff capacity, and making strategic investments that improve conditions for staff as well as people who are in custody. He's built strong partnerships with community leaders and community nonprofits working with justice impacted people. He was most recently the chief for the City of Las Vegas Department of Public Safety, and was previously acting assistant commissioner at New York City DOC, overseeing the Nunez Compliance Unit. I want to say thank you, Commissioner, in your first 2 months in this leadership role for joining this conversation. We also have Kandra Clark, who is the Vice President of Exodus Transitional Community. Exodus is a nonprofit that's well known in the reentry circle here in the city. It provides support services to men and women who are in transition from incarceration to full incarceration into their communities. They also have one of the Mach J hotel contracts. Kendra is an alumna of the Community College and Community Fellowship. She's a Beyond Rosie's steering committee member with the Women's Community Justice Association. She's on multiple councils and oversight committees, including the closure of Rikers Island and Reinvestment Commission. So thank you, Kendra, for always being part of these conversations. We are also grateful to have Cynthia Stuart, who is the Chief Operating Officer at the Supportive Housing Network of New York, which is a membership organization representing more than 200 nonprofits that run 55,000 units of supportive housing statewide. The network helped lead the 3-year campaign that led to the 2 supportive housing initiatives that we have that will work to create 35,000 units over the next 15 years. And that is New York City 1515 and the Empire State Supportive Housing Initiative, sometimes referred to as ESHI. Cynthia brings more than 25 years of experience, having started originally at CSH, my organization, as the first communications director. She also spent several years at Project Renewal. And the network has collaborated with members in CSH on a variety of projects, panels, and white papers focused on people involved in the criminal legal system, including this report and the Reimagining JISH recommendations. We're also grateful to have Mark Hurwitz, who is the Chief Operating Officer at Urban Pathways. Mark has worn many hats in the homeless, housing, behavioral health worlds. He previously was Chief Strategy Officer at the Fortune Society. He also was Deputy Commissioner at the Department of City's Department of Homeless Services. And he also founded the Mental Health Project at the Urban Justice Center, where he advocated on behalf of homeless individuals with mental illness. And we are extraordinarily grateful to have Chaplain Dr. Victoria Phillips, who is the founder of Visionary V Ministries, as our moderator today. In advocacy circles, she's commonly known as Ms. V. She leads the community health and justice organizing with the Mental Health Project at the Urban Justice Center. She's a criminal justice reformer, certified neurocoach, chaplain, invisible disabilities advocate, and she currently co-chairs the New York City Department of Corrections Young Adult Task Force and is a member of many national and local boards. She brings grounding energy and common sense accountability to conversations she's part of. So we're really grateful and excited for her moderating the discussion today. So I want to move quickly into report highlights. Please let us know kind of your thoughts and any questions you may have as we move along in the chat. So first want to start with the reality that Black and Brown communities are overrepresented in our crisis and institutional systems, right? And this includes the homeless and criminal legal systems. And BIPOC communities are underrepresented in other areas that provide social benefits to vulnerable populations, including the mental health system. So what's on the slide here is data that colleagues of mine at H pulled together that show existing racial and ethnic disparities across systems that most often refer into supportive housing. And this is looking at New York State information. And these disparities are a result of systemic failures and not individual ones. And so it's going to require systemic approaches to center equity for their undoing. When looking at New York City DOC data and comparing it to who is in the community here in New York City versus who is incarcerated, you see the same overrepresentation of BIPOC communities. And the majority of people in New York City DOC custody are incarcerated at Rikers Island. And this slide shares a few stats to understand that volume and churn. Daily population has really oscillated significantly during the pandemic. In April 2020, it was under 4,000, and then it spiked again to around 6,000. I think a really important piece on this slide is the average length of stay is significantly higher than what you see at other jails across the country. And for the group of people that we're really focused on today, people who may have mental health issues, may have substance use issues, their length of stay is almost a year, so quite significant. And in our report, what we estimate is that well over 2,500 people in a given year need supportive housing. So I just want to take a moment to define what is supportive housing. It's affordable housing paired with voluntary services, and it's designed to support vulnerable populations. So essentially, supportive housing is for people for whom without services would not be able to keep housing, and without housing, meaningful service engagement would just not be possible. And common eligibility criteria for supportive housing includes experiencing homelessness and behavioral health needs, which is why the slide shows a lot of those stats. And want to speak to how we came up with this estimate. So fun fact, there's currently no public information on shared clients between New York City's legal system, the homeless system, and the behavioral health system, which, spoiler alert, is one of our recommendations in this report. Cities gotta be able to give this information out to inform resource conversations. So what we did is we relied heavily on our organization's national estimate on the need for supportive housing for jail populations. And that's in the report if folks kind of want to dive into that estimate. But what I will say is, given the unusually long length of stay at Rikers compared to other jails, it's fair to say that this is a conservative estimate. Nearly everyone who is incarcerated is released back into the community. And it's clear from that first chart that I shared showing our racial disparities that we need to do better as a city, as a community, making sure there are resources to give our vulnerable neighbors the resources they need to be safe and to thrive. So in particular, this report and today's conversation is about people who are struggling to keep a roof over their heads and who have other needs. This could be a severe mental illness, this could be a substance use disorder, it could be both. And study after study have shown that using the intervention of supportive housing significantly reduces this group of people's interactions with crisis systems. I also want to note that over half of all people held at Rikers have mental health needs. But I really want to call attention to the women who are incarcerated and under New York City's DOC custody. Out of the 5,000 plus people, the women's population in the fall was just over 200. And if you look at the mental health needs of these women, it's stark. The quote here on the right is from a report that the More Just New York City and Center for Court Innovation released this past summer. And it says, while an imperfect measure, in June of this past summer, 86% of women held in jail received mental health services as compared to 50% of men. We have more resources in this city than in most places in this country, in this world. We can get this number down. And supportive housing is one of the tools that we need to be able to do that. I also, in talking about people held at Rikers and mental health, want to mention Brad H. and put it in the context of our estimate of the need for supportive housing. For those who are not familiar with Brad H., more than a decade ago, the city reached a legal settlement in a case that became known as Brad H. And the city agreed to provide people who are confined in its jails for at least 24 hours and who need treatment for mental health during their time there, with a reentry plan, a plan for assessing ongoing services upon release. And so the report we put out estimates supportive housing for all people at Rikers, right? So this includes people within the Brad H population, but also others who might be chronically homeless and perhaps struggling with a substance use disorder, but who might not have a mental health diagnosis. So I've defined supportive housing, I've laid out who in Rikers needs access, and I want to take a step back and acknowledge that we're here today being able to talk about how to expand supportive housing for people held at Rikers, because over a decade ago, there was city leadership, specifically a New York City DOC commissioner and DHS commissioner, who thought outside the box, who worked together to break down silos. The lore, which we've confirmed is true, is that the DOC and DHS commissioner who worked in the same building would often see each other in the elevator. And one day they finally said, hey, your people are my people and my people are your people. And we need to do something about stopping this revolving door between the separate crisis systems we oversee. And it was that conversation that led to FUSE, the Frequent User System Engagement Program in 2008 that CSH partnered in. What they essentially did is they identified who are the people who are frequently cycling in and out of jails and shelters and emergency rooms, and they used supportive housing as an intervention. Columbia did a big research analysis, and guess what? It worked. What you saw was this group of people spent significantly fewer days in jail and shelters, and there were significant cost savings to the government and to taxpayers. So communities have replicated this across the country. I'll just mention that Multnomah County, which is Portland, Oregon, and Denver has been doing this work for a number of years, and just this summer put out analyses that affirm what the Columbia study found, which is that supportive housing as an intervention works for this population. And my colleague Lauren is going to be sharing in the chat both the Multnomah and Denver FUSE analyses in case folks are interested in that. And so going back to the 2,589 people who need supportive housing, how much does that cost? It costs a lot. In a given year, the cost to incarcerate this group of people is $1.4 billion. And if the city were to instead use supportive housing, the cost in 1 year to be able to provide ongoing operations and services for this group of people is $108 million. So that's a cost difference of 1.2 billion. It's the right thing to do to invest in supportive housing. It also happens to be the fiscally responsible thing to do. And if we do this right, an investment in supportive housing that centers racial equity, bringing in BIPOC developers, BIPOC-led service providers will all help to be able to reduce the significant racial disparities within our homeless and criminal legal systems. So, want to talk about what we want to see in terms of city leadership taking action on this. So the first piece is we want to see significant investment in supportive housing. So currently the city, under an agreement negotiated under de Blasio called New York City 1515, is committed to bringing 1,000 units of supportive housing each year online. And what we would like to see is to have the current mayor, Eric Adams, double that annual commitment to supportive housing to 2,000. And within that new additional commitment of 1,000 units, to dedicate 500 of those to people who do not meet the homeless chronicity requirement due to their incarceration history. And just to give you background on this, and I'm oversimplifying a bit, but New York 1515 is largely focused on providing supportive housing for people who are chronically homeless. And there is eligibility criteria that if someone is within an institutional setting for longer than 90 days, which includes jail, your clock goes back to zero, meaning if you're chronically homeless when you entered Rikers, if you stayed for longer than 90 days, you're not eligible. And remember that average length of stay that I pointed out earlier, right? Way higher than 90 days. So we designed this recommendation to ensure that those in the city who have left incarceration will be able to access the main source of supportive housing that the city is funding. I'll also acknowledge that this is one of the most significant recommendations we are making in the report. And within the advocacy community, there are varying opinions on how to thread this needle and thinking about eligibility and vulnerability. And what is most important is that we continue this conversation, we have this conversation, and that city leadership go big in supporting this group of people who are on Rikers and need supportive housing. I'll also say that across the board, we need the city to be able to increase the rates that they are paying providers. And JISH, the Justice Involved Supportive Housing, is a really good example of this. JISH is currently the only supportive housing that's specifically dedicated for people leaving Rikers. There are currently 120 apartments under JISH, and the city would like to expand this to 500. There's been an RFP out there since 2019 and no serious bids yet, right? Rates are too low And there also needs to be some programmatic changes, which we go into extensive detail in the report and will likely be talked about during the panel discussion. In terms of being able to improve access to existing supportive housing, we would like the city to be able to prioritize supportive housing re-rentals for those who are justice impacted. So we think that there's currently between 5 to 10% rate of vacancy in the supportive housing that's already out there. I was just last Friday at a supportive housing provider in the Bronx. Guess what? They had a 10% vacancy rate. And so when current tenants of supportive housing move, the city prioritizes specific populations to fill these apartments. And given the supportive housing needs for people leaving jail and prison, we really want this population to be given priority for those re-rentals. Also want to spotlight the importance of the Mock J hotels. We at CSH are really focused on developing additional supportive housing, but transitional housing is essential within the housing continuum for this group of people. The Mock J hotels were created in response to the COVID pandemic, but they served a critical need that existed well before. And these hotels and programs provide a safe transitional space before a permanent housing option is available. It's our understanding these contracts will end in June, leaving around 800 individuals potentially homeless. So we really want the administration to be paying attention to this piece. And finally, we have a couple of recommendations around data and reporting. The first is we want to see an enhanced use of the coordinated and placement survey to improve reentry services. So just a little bit of background on that on CAPS. The primary way people in New York City access supportive housing is through filling out a CAPS survey, which is then followed by a more in-depth 2010E. We know that these surveys are being filled out for people held at Rikers, but we also know that there's gaps, that there are some people who may need supportive housing who are not getting this information filled. And we'll acknowledge that while housing is limited, completing the survey allows providers to determine eligibility for supportive housing, it gives information on vouchers, it provides access to prior homeless and housing data, which can be really helpful to discharge planning. And so we really see the use of CAPS as being critical to understanding who's experiencing homelessness, who needs housing, and who ultimately is getting access to it. And then for the second one I've mentioned before, we currently don't have publicly released information on the overlap of, just answering the basic question of who on Rikers has had interactions with the shelter system, and then what are their behavioral health needs? Because this information is really critical to understanding the supportive housing need and to be able to inform broader resource discussions. And I'll end with just that data is really critical when thinking about racial equity through any type of public policy and practice. We need to be able to understand existing racial disparities and inequities, and then need to track those, and there needs to be transparency in order for our city to be able to transform our systems to foster more inclusive and equitable communities. So with that, those are the highlights of our report. I am going to turn things over to Ms. Fee to kick off our panel discussion.
Thank you, Cassandra. Peace and blessings, everyone. I'm Chaplain Dr. Victoria Phillips. Everyone knows me as Ms. V or Dr. V, and I'm super, super excited for the conversation today. Who's with me? Are we ready to just jump in here and get going? The first question, I'm serious, we're going to get going because we're on a time limit. I know everyone's super, super busy. There's so much work to be done, housing people coming home. So Commissioner, I want to start with you. Peace and blessings. Good to see you. And first, let me say welcome in your position, your new position, and thank you for taking on the position and taking on New Yorkers, meeting with us, all advocates, and doing what you can immediately to start making changes. So I have a question for you. Fuse was initially created as an intervention of supportive housing for people in New York City experiencing homelessness, mental health, substance abuse, and incarceration at Rikers. Can you speak to the cycling of people through crisis systems and priorities you'd like the city to focus on to end this cycling, including where housing fits in?
Sure, sure. And I just want to thank everyone for the opportunity. I'm only going into my 8th week, but I think this is an important conversation. So when I was invited, I wanted to participate. To your question, Dr. V, I'll say, and to those listening, as a city, we should continue our efforts to improve addressing the needs of our most vulnerable populations. And I know that this is a priority for this administration. I think collectively, we should ensure our most vulnerable populations have immediate access to supportive services, specifically mental health services. It's abundantly clear that some people experiencing homelessness and those that are incarcerated at Rikers are struggling with mental health issues. It will take all of us, government, community-based organizations, and service providers to really strengthen access to services for people in their communities. It's also really about how do we encourage people to seek preventative services before things get worse. So I think it is equally important to focus on keeping people from spiraling back into crisis systems. But as a society, right, we really also should focus on really prevention, right? People shouldn't have to come to a jail to get services, right? We want to be able to service individuals in the communities where they are.
Thank you so much for that. Well, speaking on Rikers, well, over half the people under your oversight have a mental health concern, a mental illness. And for women, it's significantly higher. The women's population is pretty small, as Cassandra stated earlier, and with the right community resources, it could be significantly reduced. How can the women's population be reduced under your leadership?
Yeah, we appreciate and value our partnerships with our community-based providers that are focused on the needs of our female population. As a new commissioner, I'm continuing to do a holistic assessment on how we can improve services for our female population and ensure that their needs are met while they're in our care. For what I've seen so far, we have a dedicated facility, we have dedicated programs teams at Rose M. Singer Center, where the females are located. However, I recognize that there's more we should and could be doing. So since the start of my tenure, I also have met with external stakeholders who have shared suggestions and feedback on how we can do better and really meet the needs of our female population. So I'm happy to keep this group updated as well as the public as we discuss the important topic internally with our criminal justice stakeholders.
Awesome, awesome. Trauma is real and everyone in the city has something going on with them. So can you speak to the importance of supportive housing pathways for those who are just as involved, whether leaving Rikers or state prison? Because that's important as well. And what are the constraints to getting people housing? Housing is such important, so important.
Yeah, so what I'll say is, and I think it was what was shared earlier in the presentation, right? Thinking outside the box like the former commissioners did, right, at the Department of Social Services and DOC. Really we should look at what role supportive housing can play really in the expansion of what I would say are alternatives to incarceration, right? Because I think that can help towards, decreasing the population that's incarcerated. But in addition to alternatives to incarceration, I want to also think about returning citizens, right? Whether they're returning from Rikers Island back to their local communities or state prisons, right? How do we give those that are justice involved, those that are formerly incarcerated, provide for them what I think for me is really the continuum of care that these individuals need to address their unique needs. And when I think about the various populations, this could impact emerging adults, right? Our young adult population, those under the age of 24. We can look at those that have issues related to mental health, some serious mental health issues that really can thrive in a supportive, structured living environment with case managers, and really our aging older population that's coming back from formerly incarcerated, that are always going to need some level of support and navigation to be able to thrive in the communities where they came from. So for me, supporting housing is important.
Awesome. Thank you so much. And I want to continue the conversation with you, but I know you're on time constraints, so I wanted to get the most questions out to you directly, but I want to bring other people into the conversation. So let's open up the floor. Kandra from Exodus, let's jump in here. Hi, how you doing? You look so beautiful on screen today. So I wanted, Commissioner mentioned hotels, and so I know that's your area of expertise. And so I definitely wanted to ask you, how has hotels played a role in stabilizing people who are released from Rikers? I know you and I have actually worked behind the scenes on this quite often. So could you include a certain story or something that Exodus has been working with, or people they've been working with, or exactly what that looks like, so everyone in the city can truly understand what you're working with?
Yeah. So, the Mock J hotels that Exodus began running was at the height of COVID in April 2020. People could not be released to shelters due to social distancing. And so us, along with several other providers, were asked if we wanted to operate these hotels. Exodus stood up and said yes, right? We're a justice impacted organization. So 80% of our staff have, direct experience of incarceration, and we knew, and homelessness as well. And we knew that during this time, our folks were so vulnerable. So when we first got the hotels, we definitely wanted to do a little bit of a different model. We have 24/7 staff that are on site, and it's a partnership. So we have Housing Works that provides medical support, while our Exodus staff provide case management. We have social workers, CASEX, which is certified alcohol and substance abuse counselors, housing specialists, job developers, and then we have a private entity that provides security as well. So it's definitely been a collective effort. There's been other organizations that have provided donations and really helped to fill gaps and meet needs. And, a big difference for our folks there, and for all of us who have been in the shelter systems ourselves, that having their own room, having agency, having a really safe space where if they need a break from other people, they can go to their room, right? It's not a congregate setting. That's been really inspirational for folks. And I've heard a lot of people, directly say that they were not going back to shelters if our hotels closed, right? And I've even witnessed it firsthand with people coming in who haven't been able to get into the hotels yet because we have a waiting list, who are choosing to live in parks or live in streets because the shelter system is often more dangerous, or there's more, drug use, and it's just a more unstabilizing environment. So, for us, employment and housing are our two primary concerns, like getting people transitioned. We have one hotel specifically that 100% of our participants are working, and we're working with all of them now on various vouchers and other housing solutions so they can transition to permanent housing. And I think some of the examples of how we've been able to intervene, like the Mock J hotels, fill that gap for folks that are being released but don't meet the HUD chronic definition of homelessness. So they're not able to even qualify for supportive housing yet, or are not able to get employment right away and get a voucher right away, right? So we work with agencies across, New York City. One of them is really the defender organizations. And what we've been able to do specifically, I have one example of a 19-year-old that was on Rikers who had serious mental illness. And we were able to advocate with other defender organizations to get him released. And the only way that the judge was going to release him was if he had somewhere to stay, right? And so it was really important for them to have that space. Since we've had him, we've got him stabilized on medication. We're getting him into services. So he's able to be stable in that space. And, another really great example of how we work with DOC also, and I just want to give a shout out to the LGBTQ director, Liz, that works there. We just recently got a trans woman released, and she had nowhere else to go. She's been in the shelter system several times before and experienced a lot of trauma. And so she was adamant that she was not going, and we were able to get her released into one of our hotels. And again, like as Liz said, if we weren't able to do that, this woman would have definitely went to the streets because she was adamant she was not going to a shelter. So, I see our work as very collective. We have to be coordinated with DOC, with the defender organizations, with the mayor's office, with all the other providers, the Urban Justice Center. I mean, you guys, we talk to you a lot around referrals to really make this work. And I think that collective leadership is definitely something that we should infuse in future models.
Awesome. That was a load of work that you are doing over there at Exodus, and New York City appreciates you and love you. But can you elaborate just a little bit more on what it actually means to move someone from a hotel into permanent housing? because that is super special. And I know you said a 19-year-old getting out and working to get him housing. And I'm thinking about when I was in foster care and what it actually means to turn the key into your own place that no one can put you out of so you can sleep safe at night. So what does that look like moving into permanent housing?
Yeah, I think housing is so important to all of us because we all went through it, right? I couch surfed for 5 years coming home from prison, then was in a very small studio for 5 years trying to make everything work. So all of us have had experiences with housing ourselves, and it makes it very personal for us. We see those challenges, we cry with folks, we, build people up, we let them know that we went through this too, and we're gonna stick with them to make sure that they get it. I think, a little history of the challenges that we experience, and there's so many of them. Our MOCJ hotels are, because they're funded through MOCJ, our folks don't qualify for DHS-based vouchers. So since the very beginning, I've been a huge advocate and kind of testifying everywhere to say, hey, we're not warehousing folks in these hotels, right? And that's kind of what we were expected to do if we're not able to access any of the other housing resources for our folks, right? So that was one big, huge issue. And, through a lot of advocacy, we have received some EHV, HPD vouchers. And I want to give MOCJ a shout out, HPD, NYCHA. I mean, to really step in, they've given us hundreds of vouchers, and we have about 89 people in the pipeline right now to get a voucher and then get into their own permanent housing. That has been a lifesaver. I think it's also given folks hope, where initially coming to the hotel, your hope kind of got dwindled at first when you realized that you didn't have access to certain things because of bureaucracy, because of a funding source, right? And I hope that's something that we can continue to keep working on and fixing in the future. We talk a lot on our Reinvestment Commission and other, advocacy outlets to keep working towards that. I think another thing that we experience and our folks experience specifically is NIMBYism, discrimination. Fair chance for housing didn't get passed. So regardless if we're moving people into housing with no voucher, housing with a voucher, or supportive housing, the discrimination that people experience because we're justice impacted is real. Real estate developers discriminate, brokers discriminate. It's very tough out here. And getting the fair chance for housing passed, which is Intro 2047, that's in City Council. They could not pass it last year. We want to get that passed this year because it matters. It means something. People are discriminated perpetually for their justice impactness. And then, the lack of supportive housing. So even as we're doing, 2010Es, especially right during COVID, right? And I think that was a whole nother barrier, COVID, just in general. People are working remotely, systems are down, the city was shut down kind of for a couple months just right away. So that has also created, but there's about a 200,000 unit shortage folks talk about for supportive housing. And that's why I'm so happy we're all in this today, really speaking about this, because the need is so great. And I have two really great stories of examples, and I'll be really quick. One of them is a gentleman who just got his own keys to his apartment, I want to say 2 weeks ago, maybe a week and a half ago. And he was with us since the very beginning. He was one of my first participants at our first hotel. And he has come to advocate with us. He was at one of our rallies outside Rikers, and he got to speak and testify. So he's also become an advocate in his own right throughout this process. And, I just talked to him the other day because we're getting him a bed and some dressers and furniture on top of some of the other stuff, right? But for him to finally have his own keys after, this whole process that's just taken so long, it just made us smile so much. I mean, nothing could make us happier. And then another one is, recently, and I want to give a shout out to the Women's Community Justice Project. Sometimes I had a young woman who was pregnant, who was in our hotel, right? And she found out she was pregnant after she had been in our hotel. And I wanted to make sure that we could get her into like a family apartment, like a family unit. And that's where WCJA comes in, right? The Women's Community Justice Association. They have gender responsive housing specifically for women who are pregnant, right? Or families. And, having that connection and being able to see her move and then follow her throughout this process to where she's had her baby and now she has her own apartment. That has been a very beautiful experience for us as well. So there's nothing greater, I feel like, than, helping someone get their own keys and moving into their own home. And I could tell you hundreds of stories of how we've been able to do that and the lives we've changed. So thank you for that, Ms. B.
Thank you for those wonderful stories, those wonderful examples. Just really quickly before I move on and transition to my next questions, I really want you to touch in 60 seconds or less, because I have to keep us on time. There are rumors out there about the Mock J hotels. And so how does that look in the community? Because I visited them and I believe they're safe for the community and they help the community and uplift the community. But what can you tell the people to speak about the benefit of having them in the community?
Yeah, you know, we've proven, we've had a one community advisory board that we've been on for a while, since the beginning. And again, it's been 2 years of NIMBYism, right? But we have the precincts on the calls with us, and, you know, they let the community know that, like, our hotel has not increased crime in that neighborhood. And I think we are really good about, if there's an issue, reach out to us, right? We have had, you know, some store owners reach out, and we've been able to mediate and fix the issue, right? Like, we're here to help the community do that. And I think what's been really good too is some of our, like, hotel communities have said that their community has actually benefited from that, even, like, financially. More people are using their stores, more people are coming out and walking and using the parks and using the communities. So I think that there's just as many benefits, or even more benefits really, than, you know, negatives about any folks staying in the community.
Thank you so much. I appreciate you for answering that. And I just want to shift gears another way. And Mark, I want to bring you into the conversation, because so much has been mentioned and you've had a front seat over the years in New York City, establishing supportive housing programs for people in crisis, right? Including people leaving Rikers and even being homeless. And so how did we get here? Fuse and the evolution to the current GISH. What is GISH? And I'll start there, because that's a lot. How did we get here, Mark?
Thanks, Dr. V. Well, I have had a front seat. I was actually at the meeting of the two commissioners who met in the elevator, the first meeting, and I'll talk about that in a bit. But 25 years in the scheme of things, I've been working on this, is not a long time. So I actually want to go back in time and talk about how we got here by talking about 3 books. In 1890, Jacob Riis wrote How the Other Half Lives. That book had photos of what was then the institutionalization, in a sense, of what were called tramps. Homeless people were rounded up every night by the NYPD, and they were put into police station basements, and they were then put out the next day, and they'd come back again. So there was a cycle even back then in the 1890s. And there was a commissioner at the time by the name of Teddy Roosevelt. He read that book and he said, "This is terrible, we're gonna shut it down." And 1909, first shelter opened in New York City, first municipal shelter. It had 964 beds. Believe me, those beds would not have passed a Callahan inspection. They were very close to each other. So we really have, you know, the start of institutions are bad. People shouldn't live in institutions. People thrive in the community. Let's shut down the institutions. Unfortunately, then it created a whole other institution called the New York City shelter system. Meanwhile, people who had behavior disabilities were not only being incarcerated, they were being hospitalized. In 1948, Albert Deutsch wrote a book called Shame of the States. That book, in the preface to that book, he said, "The day of the individual crusader is over." He didn't want to just be him. He wanted all of us, and we are all crusaders. He wanted everyone to say, these institutions are not helping people. And so, you know, in 1955, at its peak, New York State had 93,000 individuals who were locked into state psychiatric wards. Right now, there are fewer than 2,000 people in New York State hospitals. And then I'll move fast forward to 2010. Probably most of us were born before then, so we can remember Michelle Alexander wrote a book called The New Jim Crow. that popularized the words mass incarceration. And also the fact that mass incarceration is the civil rights issue of our time. 9 years later, New York City Mayor, New York City Council announced we are going to close down Rikers Island. And so here we are today, still struggling, but I think we have come a long way. And there's been a lot of people that I see who are, part of the audience today, a lot of people on this panel, and many, many people work together to get where we are. We have a lot more to go. I think that Cassandra did a great job sort of explaining that elevator meeting between the commissioners. I just want to highlight the city really has to keep doing these data matches. It's critically important, not only to figure out the size of the problem, but to identify the specific people that need the most help. And that's what really led to the Fuse project, was that the two commissioners matched their data. This is very easy to do now. We have computers. The city could do that very easily, and the city has to be transparent. Please do not be afraid of information. Information helps us do what we need to do, understand the problem, and get to where we need to be. Some of the results of Fuse, 91% of the people that were housed in the original Fuse, which stands for Frequent User Service Enhancement. These are people that have multiple stays in not only Rikers Island, but in the city shelters. 91% stayed housed after a year. Shelter use in the city's shelters declined by 70%. Rikers Island days in jail declined by 40%. So this works. The city did mainstream it. It's not just a demonstration now. It's something called JISH, another acronym, Justice Involved Supportive Housing. Urban Pathways operates 30 out of the 120 beds of Justice Involved Supportive Housing. That works too. And people thought you couldn't just have someone discharged from Rikers Island and have a housing apartment, permanent housing available on their first day. You can do it. It's way too small. We're only able to admit, because people stay so long, maybe 4 people a year. In 2020, we accepted 4 people into our JISH program. They all stayed over a year. So it definitely works. Is it perfect? No. So what needs to be done? One is 120 beds is nowhere near enough. And the city issued an RFP and nobody applied. And the reason nobody applied was the funding was not sufficient. Giving people an apartment is necessary, but for people with serious behavioral issues who need a lot of help and a lot of support, the funding has to be enough to afford an apartment in New York City and to provide support. So I think the recommendations in the report are right on. City needs to reissue that RFP and with sufficient funding. Also, the city is looking at congregate housing. Scattered site housing is great for some people. It's very hard to do. There's not that many providers like Urban Pathways that actually want to operate scattered site housing, because it's very hard without the on-site staff. So congregate housing is another important model that the city should get behind. There is an issue that we have people come in, there is no housing application. In a way, that's great. But if there is the so-called 2010E application, that would be helpful. And that maybe I'll talk a little bit more if I have a chance about Brad H, but that really should be done for many more people with serious mental illness leaving Rikers Island. And I guess the last thing I want to say about housing is it doesn't all have to be specialized for the reentry population. There are not enough exoduses and fortune societies and Osborne associations who specialize in this population. And part of what Urban Pathways is doing with Trinity is we want to demonstrate that a supportive housing provider that really specializes, say, in working with people with mental illness can serve this population and should serve this population. So all supportive housing providers should be reentry providers. And the city, through its CAP system and other systems for prioritizing people, should ensure that this is not just a specialized population that should have 120 beds. These are people who move in and out of these different institutions. And just because they happen to be at Rikers Island today or in the shelter system tomorrow doesn't determine which types of housing they should get.
I so agree with you, Mark. Absolutely 100%. But you know, I could talk to you all day just on that area alone, but I want to bring one more person into this conversation because I just feel like there's so much to say and I just want everyone to hear everyone's voices right away. Cynthia from the network, how are you? Peace and blessings. Let's just jump right in. So you heard everything that's going on. You're absolutely a part of the conversation. So from your city perspective at the Supportive Housing Network of New York, how do the report recommendations fit into the larger supportive housing acts that the network is leading?
Thank you so much, Ms. V. And thank you all of Trinity, CSH, Mark, Kandra for including the network and me in this conversation. Really appreciate it. So yes, short answer, the report aligns extremely well with the network's advocacy asks. As Cassandra said at the beginning, the network is a membership organization that represents 200 groups statewide that run 55,000 units of housing. And a number of our members work directly with justice-involved individuals, and that's their core mission. But virtually all of our members house people who have been involved in the criminal legal system. And also we helped lead the push, the 3-year push to get NYC 1515 and ESHI, which is the very first statewide commitment to supportive housing that prioritizes the reentry population. So, which is going to create 20,000 units over 15 years statewide. So yeah, our advocacy asks right now, with the governor are in great shape. We were delighted with the governor's budget, which included 10,000 promise of 10,000 units preserved and created over the next 5 years as part of the housing plan. And that's extraordinary. And as well as a 5.4% COLA for our workforce, long incoming. So that was terrific. And because it's included in the governor's budget, we're hopeful that that's going to go through in the final budget. The mayor's budget, preliminary budget, did not include housing. And we understand that the administration is hard at work on a housing plan that will be comprehensive. So we haven't seen the commitments that we've been looking for. So as with CSH's recommendations, we too want to double the city's commitment to supportive housing each year, turn it from 1,000 units a year to 2,000 preserved and created, and that 700 of those new units be for people who do not meet the eligibility criteria about chronicity. So that would include the justice-involved population. And we're still very, very, very hopeful that that is going to be part of the mayor's plan, as well as if matching the 5.4% COLA that the state did, because our workers were the essential workers all during this pandemic, and they haven't seen a raise in 10 years. So about the commitment to supportive housing, we're very hopeful that the mayor will see fit to increase supportive housing in the city budget and include new units for this population. And this population, I've been part of advocating for supportive housing for a really long time. And we've used the cost effectiveness argument for a very, very long time, and have lots and lots of studies about the cost benefits of supportive housing, that homelessness is really expensive, especially for people coping with behavioral health issues. But for this population, it's kind of a slam dunk, because as the Comptroller Stringer put out a report at the end of 21 that put the daily cost of a jail cell in New York City system at $1,525 per day. $1,525 per day. I just also checked what the Plaza is charging these days, and they've cut their rates in case you're thinking of a vacation. So it's twice what the Plaza is now charging. So we know that the mayor very much wants to cut waste and make the system as efficient as possible. So basically, if he were, as you saw in the earlier slide, the Brad H population is staying an extra 135 days in the city prison system, jail system. And if we were to monetize that 135 days times 1,525, my math is that we would save $200,000 per person if we were to interrupt the cycle of jail and shelter with supportive housing. We also know that he likes things that work. And as Mark just eloquently talked about Fuse, we know that supportive housing permanently interrupts the cycle of homelessness and jail use. So he should like that. We think that it's obviously the most efficient and humane use, just going to go with humane use of public funds. So there's that. So yes, it aligns.
That is a lot, Cynthia. And you know, I really want people to fully grasp what you're saying, because you know, I've sat on the advisory board for DOC for like 6-7 years before doing the co-chair task force. And to watch the amount that it costs to incarcerate someone continue to rise, even from when they voted to close Rikers to now it's over $500,000. Then it was like $371,000 when they voted to close Rikers. Now it's literally over $500,000 per individual being incarcerated. And so when we think about the cost of housing them, the cost of their medical care, their mental health care, substance recovery assistance, it doesn't equal half of that. It doesn't equal half of that. And so what are we doing wrong, right? But for you, I want to say, can you speak briefly to the work that your members, your supportive housing providers across the city and state are doing in this space?
I'd love to. Our members, as always, are doing amazing things. And I see a lot of former members and former colleagues on this call. So hi, Joan. Hi, Connie. Sorry, I had to do that. You know, they pioneered the supportive housing model, and they continue to evolve it. And you know, it was our members who made Fuse work with the incredible leadership of Richard Cho. Have to give him a shout out. He's not on the call. And CSH for, you know, pushing that through. It was our members who both participated in JISH, the first one, and still participate in it, and crafted recommendations for a reimagined and fully funded JISH 2.0. So, you know, they're brilliant. Fortune Society is a proud member, and they're using eShy right now in a brand new building in the Bronx, as is The Bridge. Housing Plus opened a beautiful new building in Brooklyn. Our Children is working on 3 eShy funded residences in Queens. Center for Community Alternatives, Open Freedom Commons in Syracuse. Spiritus Christi Prison Outreach has 4 projects funded by ESHI underway. And then, you know, our groups, they just never stop coming up with great ideas. So proud to have worked with the Women's Community Justice Project, and proud to have watched Drew House become a reality over many, many years. So people are thinking about how to use supportive housing in a lot of different places in the cycle of institutionalization and homelessness to keep people whole and to, as you know, save a lot of money. So there are more than 20 projects I figured out as a result of ESHI statewide. And in today's West Side Rag, there's a piece about Fortune Society, who I imagine are going to go for ESHI, and are going for a project on the Upper West Side of Manhattan. So that's extraordinarily cool. So yeah, our members are amazing.
Thank you for that. Mark, I wanted to ask you something about Brad H, but before I get to that and that question, I really just want to backtrack a little bit because Cynthia mentioned JISH a couple of times. And so I wanted to ask you, where do we go from here? What are the possibilities of JISH?
Well, I think, as I said, I think JISH really should be expanded, and it has to be fully funded. Back to the data, if the city really shared data, it would get a better sense of the need. And supportive housing really should be prioritized for the people who need it most. And that's really what was behind the idea of Fuse and JISH. Who are the people who, since we don't have enough for everybody, who are the people who should get this extra level of support? And I think it's not only the fact that people use a lot of shelter, use a lot of jail, but now we have correctional health services on Rikers Island because of the Brad H lawsuit, which I know you're about to ask me about, doing in-depth assessment of people. And those are really the people who should be prioritized for a program like JISH.
Wonderful. Thank you for that. So mentioning Brad H, so you founded the mental health project at the Urban Justice Center, and I've been there for the last 7 years, so thank you. And you were around at the beginning of the Brad H settlement. So from your perspective as a provider, where are there opportunities to strengthen how Brad H clients, as well as others, are connected to supportive housing?
There are a lot of opportunities. The Brad H lawsuit, it was settled with the city in 2003, and it created it was a class action lawsuit. So the class is people who are seriously mentally ill on Rikers. And the idea of the lawsuit was just like if you're in a psychiatric hospital, the mental hygiene law gives you a right to a discharge plan. That discharge plan should include housing. It should include an assessment. It should include ongoing treatment. It should include really all of the supports, but it's not just a piece of paper. You know, the person should be discharged and that plan should be effectuated. And, you know, because as a part of the settlement, a monitor was appointed to make sure that these plans were happening, that these plans are real. And it actually resulted in quite an influx of resources onto Rikers Island through correctional health services of behavioral health specialists who work with people who have serious mental illness. And even though these reports that the monitors produce are long, they're 150 pages long, they're really worth reading. And I'll just highlight a couple things from the reports. One is they pick cases and they do case-by-case examples of people leaving and whether the planning was adequate or not. And in a lot of cases, it actually is pretty good. But what you see is that the people who come into Rikers Island with serious mental illness, they're eligible for and they're on and off connected with all kinds of different specialty services. And just the acronyms alone could make your head spin. So, and these are acronyms for things that are not connected to housing. I'm going to throw a few out. Those of you that are, geeks can read the report and look up these acronyms. ACT, FACT, ACT, FACT, AOT, SPOA, CRAN, IMT. It goes on and on, psyches, it goes on and on and on. So this stuff is really, really hard and really, really complicated. And we need good people who are doing the discharge planning at Rikers to understand it. And the city should not push to make this lawsuit go away. It should keep going. The work is not over. The monitoring needs to keep happening. Another thing that, and this is just one of the many things in the Brad H. lawsuit, at the time, the best placement for someone who couldn't go into housing, and in 2003 there was no GISH, there was no FUSE, so it was really mental health shelters, specialized shelters. And so the Brad H. class has a right to be placed directly into a city mental health program rather than having to go through intake. And I think we've all heard, from people on the street, I don't want to go to Bellevue, I don't want to go to the intake. So they can at least get around that and go into a specialized mental health shelter. But actually very few people are doing that. The loophole is they have a right to go to a mental health shelter if a bed is available. So you can imagine on any given day, is there a bed available in a mental health shelter? Probably not. So the most recent report concludes that the reason so few people are going from Rikers Island directly into mental health shelters is because there's just not enough beds available in mental health shelters. And that's also worth, I think, the city kind of digging in and doing some further investigation as to what happens after. What I don't see, and I don't think the Brad H. Lawsuit really has the ability to do this, the city would have to do this, is to sort of look at some of the people who are discharged and did 2 weeks later, a month later, a year later, did any of the plans actually happen? Because a plan is only as good as the follow-up. So I believe that the follow-up is going to be critically important for the Brad H. population. The more supportive housing, the more people will have that opportunity to go directly into housing. But there's going to be, in at least the near future, large numbers of people with serious mental illness leaving Rikers and really falling through the cracks. And Brad H. is a very, very important lawsuit for continuing to work on fixing that problem.
Thank you, Mark. Thank you for that. You said a lot of important information and you mentioned supportive housing. So I just want to bring Kandra back in really quickly before we move to Q&A. So I can ask you one question about supportive housing. Why is it important for Exodus to move into supportive housing space? What is that process and what does it involve?
Yeah, so, I will definitely state on the record that once DOHMH increases the funding for GISH, Exodus will be applying for that. I think that we've went back and forth multiple times, and it's really frustrating as a development professional to try to kind of have to figure out how to lean up 6 different sources of funding to make something work, when as the city, this is an issue, the city should fund it to scale, right? I think it's very complicated in the housing world because very few of any of the RFPs actually cover all of the costs, if any. And so we really have to be strategic in how we align things. And it's just extra steps, right? And a lot of extra work that gets put into, trying to just do one housing development. So we are working across the board on creating supportive housing because, like they said earlier, there's very few sole reentry supportive housing providers. And then even just providers in general, right? I mean, I think there's still such a need, having more providers like Exodus who have the cultural competency and the experience in other ways to be able to kind of navigate this. And the process has been really beautiful. You know, CSH, I will give them the hugest shout out ever. When I started this whole process of even understanding housing, like I learned it from the ground up. People in the hotels used to think I was a housing specialist. They didn't even know I was a VP, because when I was sitting with you and I was learning about how to do this when we had no one, right? And it was just the very infancy, like we had to learn from the ground up. And so I'm really happy that I did that and went through all of the trainings that CSH put forth. I've called them 1,000 times, emailed them, met with their lenders. We're now, you know, going to be applying for a loan application to have them be consultants on some ground up development work. So we're applying for NYC 1515, and Cynthia, I'll speak to you about that offline, you know, for developments that are already up. And then we also want to do ground up. I want to do some hotel conversions. I mean, we're open to all of it. I think what I've learned the most too is there does need to be different types of housing for folks, right? Like I have some folks in our hotels that absolutely need on-site, like full medical services, right? Or you know, having that extra layer of support. So congregate settings are better for them. And you know, that was a tough pill for me to swallow as a just human, because going through congregate settings in jail, you know, when you come home, you want your own space, right? But it's really understanding like the needs of individuals and really meeting them where they're at. And there's not one housing model that fits that. It's got to be a variety, and it needs to kind of be all of us collectively taking this on. So we're really excited. In 2022, housing is our big focus to really make sure that we create all these different avenues.
That is awesome. And I just want to thank everyone for having such an amazing conversation with me. And before I turn it back over to Cassandra, I just want to remind each and every person that's listening, today's conversation is super important. And I want to highlight the fact that in New York City, Black and brown people are the ones filling up the jail cells. Unfortunately, we are preyed upon. And I know I'm going off track, but I just want everyone to stick and understand when we talk about housing, how important it is. And when we talk about housing, to remember to include families, because just because you need treatment or you need assistance does not mean that you cannot parent or that you should not have the ability or the access to do so. So when we talk about healing and moving forward with our community members, we have to look at all parts involved. Cassandra, where are you? I want to welcome you back to take over the Q&A portion. Thank everyone. I've had a lovely conversation. Thank you for allowing me to moderate.
Thank you so much, Ms. Fee. Thank you to all of our panelists. We're going to move into Q&A. So I see a couple of questions in the chat. Please add them. I'm also just going to quickly mention what the call of action is here. What we would love to have everyone do is for you to share this report widely. With your network, with your colleagues, with just those in your circle who would be interested in uplifting this information. We're currently working to identify champions for these recommendations, both within City Council as well as in the new administration. So if you have any contacts, if you have any leads, please reach out to us directly. I'm going to put my email and phone in the chat. And then just know that all the organizations that have been part of this panel, we are going to be working closely together in doing this outreach to City Council and to the administration. So if you are interested in collaborating with us on that, please reach out and let us know. So with that, I'm going to turn to the chat. The first question that I see, and we will be sharing the video recording, is Charles asked, what are some of the exact services you provide that have produced the most with eSHI, which is the state-funded supportive housing piece? Cynthia, would you mind sharing kind of an example of one of your members who received eSHI funding and an example of some of the services that they provide to their tenants?
Right. Well, I never like to talk for our members, but that said, you know, it's the classic supportive housing services, which is case management that's voluntary, client-centered, helping the individual achieve whatever their goals are. So help connecting to healthcare, help connecting to mental health care, help connecting to recovery services, help connecting to education, back to family if that exists, reuniting with family that you might have lost along the way, getting a job, whatever the tenant is looking for to take the next step in their lives and be their best self. That's what the case manager helps connect that person to. Does that answer the question?
It does. Thank you. I'm looking in the chat and there's a lot of comments around the Fair Chance for Housing Act, which is really important legislation that CSH signed on to. It did not pass at the end of session. Wondering if there's anyone on, whether it's Ms. V, maybe Andre Ward, who could just give an update on where this legislation is at within City Council, if it's being reintroduced in 2022 is one of the questions.
I'm happy to report that out. Dr. V, certainly you want to add to or chime in, or others. But we're at a point now, obviously, that we're really fired up to reintroduce the bill. It didn't make it to the floor for a vote. Kandra, Dr. V, and so many others on the call have obviously been staunch champions of the passage of this bill, and we're continuing that momentum in 2022. And Allison Wilkie, who was unable to join today because she had another meeting, would certainly echo those sentiments. And so we're looking to identify now, as the chief sponsor, the majority speaker, Keith Powers, to assume sponsorship for that bill. We're working on that now. We have been meeting. We encourage and invite all of you who are on this call to join the coalition to support it. CSH done some fantastic work. Want to acknowledge Patricia Hernandez, who's an absentee, but her and Cassandra and the rest of the folks at CSH for supporting Fair Chance for Housing. And we're going to continue to move forward. Dr. V's voice, Kandra's voice is so important to that coalition. We look forward to obviously their continued support. And that's just an update, right? We're meeting now with some of the city council members. As all of us know, many of us on this call know, there's a new class of city council members to whom we're going to be meeting with frequently to engage the speaker, Adams, as well as the mayor, right, to make sure that this important bill, Fair Chance for Housing Act, is passed. So thank you, Cassandra, for giving us a couple of minutes to amplify that, and we look forward to people to supporting. And just acknowledging Wendu from Osborne and others too who support the Fair Chance for Housing campaign and are staunch leaders in that work. So thank you, Cassandra.
Yeah, thank you, Andre.
Add
go
to
ahead.
that real quick too.
Yeah.
You know, the reason that bill did not get passed last year was real estate developers and fear mongering tactics, right? And so, you know, just as community members, we've got to stand up even stronger in 2022. When community members are using fear mongering tactics, like, we have to be bold and brave and not let that beat community and healing, right? Like, we've let capitalism and racism and NIMBYism beat out community and healing and love and fiscal responsibility also, right? So just as all of us, I really want to challenge all of us this year to kind of take it up a notch when it comes to like the, you know, entities that have that power to turn stuff down, such as what the real estate developers did. Let's make sure we don't let them do that in 2022.
And just very briefly to that point, we're going to be developing a whole media campaign to counter the misinformation, right, and negative kind of views that are put out through the media. So look forward to that and ideas. And we want to thank folk like Trinity and others who are supporting that very important part of the narrative work that we need to be involved with.
Can I just say something? I just received a notification that the mayor vowed that every homeless encampment will be dismantled. And so I just want, that just sends something through my soul. So everyone in this call, I really want you to understand what that means, because when you're homeless and you only have a little bit of things, or you might have a lot of things, you have a place where you set your things up, and the city comes in and they destroy them, they throw them away, they discard them. You lose a bit of yourself. Anytime you have to go to a place that you don't want to be, that everyone's in your business, everyone's violating you, you lose a bit of yourself. So I really want people to understand how important housing is. The next time you put your key in your door, think about how blessed you are. The next time you go climb into your bed. Think about how blessed you are. The next time you go use a bathroom and can close the door, no one's gonna bust in there on you. Think about how blessed and safe you are. And then think about what you can do right now today in your community to push things forward, to make it happen, to hold those in position of power accountable, to help us get these bills passed, to help us, whether it's locally, whether it's statewide, to help people like Kandra, people like Cynthia, people like Mark that are out here doing the work that trickles back to our communities, Black and brown communities. Let me be very clear. You might not have seen a lot of Black and brown people today in this conversation, but do not be mistaken. The people who was talking about this set up things in place to help our people. So do your job. Everyone has a place to help the next person. It's part of humanity. I'm about to cry. Sorry.
Yeah. No, thank you, Mrs. V. And I want to uplift that. And I also want to uplift what Wendell from Osborne put into the chat, which is that most of the conversation today has been around permanent supportive housing. But let's not forget about the need for transitional housing for those who are returning home. I want to note that a really important piece in our report is that if the city were to make this investment in supportive housing, they would avert billions of dollars right now that they're spending on incarceration. And what city leadership needs to do is divert that money into not just supportive housing, but into a whole range of different things, which includes affordable housing. We specifically call out the kinship program that Osborne has gotten off the ground in the last couple of months, which is really important. And so I think a big piece of this report is that supportive housing is an important piece. It's also going to help create a lot of cost savings that need to be used in a whole range of things, which is affordable housing, which is alternative to incarceration, and other pieces. Looking in the chat to see what other questions folks might have. I'm just seeing a lot of folks uplifting what was said.
I just elaborate on what Dr. V said about encampments. I think it's really important, and I think we need to give a new mayor, some education and assume that his heart is in the right place. But it is not a crime to exist homeless, and so I think we have to educate not just the mayor, but all elected officials. When you speak about homeless people, don't use words like cancer, don't use words like cleanup, and don't say you cannot exist homeless on the subway. And so, there is precedent for good collaboration between law enforcement and street outreach. There is precedent. Law enforcement and the criminal justice system is not going away tomorrow. But we just really have to educate all of our elected officials about it's not a crime to exist. And I think that's part of, what you're getting at when you talk about these encampments. And hopefully if someone's leaving an encampment, they're leaving from someplace better. It's clearly not something that any of us would feel proud about, that in 2022, a homeless person would have to sleep in an encampment.
Yep, thank you, Mark.
I just want to lift up both Ms. V and what Kandra said in terms of advocacy. Your stories are the most important thing. The stories of people, putting a face on who it is that we're talking about is so important. And it's really, really persuasive. So in terms of educating the mayor, we need to talk about the people, like Kandra's clients at Exodus, like supportive housing tenants. We need to start using those stories to educate folks who are uninformed and frightened.
Thank you, Cynthia. I'll also mention that CSH is working with Enterprise right now on a few things, some trainings, but also thinking about how we can dispel some of these myths. So that's work that we're going to be partnering on over the next couple of months. I'm also going to put in the chat, since I have not yet, my contact information for folks who want to be able to stay in touch regarding this report and reaching out to city leadership. We just have 2 more minutes left, so opening it up if there's any other questions you would like to ask these wonderful panelists before we sign off. So this is certainly a conversation that's going to be continuing.
Just want to say thank you, CSS, because you are so awesome for doing this report, for bringing this panel together today, for teaching, educating, and organizing. So blessings upon blessings to you and your organization.
Thank you, Ms. V. It has been wonderful to collaborate. We would not have been able to do this work if it was not for the network partnering with us, if it was not for, you know, the Mark Hurwitzes of the world who helped us out with figuring out the JISH modeling pieces, Kandra being able to help us out and understanding what was happening on the ground with the Mock J hotels, and Ms. V for being able to facilitate all of this and always being present in these advocacy meetings and letting us know what's happening on the ground. So this is a team effort, and looking forward to staying in touch and getting these recommendations across the finish line.
I see John has his hand up.
Yes, John.
It was inadvertent, but I just want to say thank you. I was typing in the box. It was wonderful. The panel was great. The conversation was great. And we've got a lot of work to do together to make good things happen. But thank you to everybody.
Thank you.
And I really want to give a shout out to Cassandra as well. She's done an incredible job pulling together this report, researching all of this information, putting together this panel, and really working to educate our city and bring people together around this topic. So Cassandra, thank you.
Thank you, everyone. Looking forward to staying in touch.
Peace and blessings.
Take care, everyone.